We're going to continue on with Chapter 14, where we're going to talk about nutritional requirements during growth and development and eating habits as the baby grows that will affect oral health. So feeding patterns for infants during the first 2 years can contribute to their orofacial development as well as their swallowing patterns. The actual growth of an infant is kind of interesting. Birth weight doubles in the first 4 months. So a 7.5 pound baby will become approximately 15 pounds in 4 months. And then by the first year, birth weight triples. The length or height will increase 50% by age 1. Energy requirements, which again, remember energy is calories. So per kilogram of weight in comparison to an adult, the energy requirements for an infant are much higher. 3 to 12 months requires 83 to 95 kilocalories per day per kilogram. Adults, 29 to 37 kilocalories per kilogram per day. So you can see it's more than double what an adult needs per kilogram. They have a much higher resting metabolic rate. There's so much going on in an infant's body all the time growing, so their metabolic rate is off the charts. Protein recommendations from birth to 6 months is 1.52 grams per kilogram per day. And then at 6 months and beyond, it's 1.2. So it goes down just slightly once they reach 6 months. This translates to about 9.1 to 13 grams a day of protein. And their protein should not exceed 20% of daily caloric intake because their little kidneys are still immature. And as we know, proteins are filtered through the kidney. So too much protein could be really hard on infant kidneys. The best source of nutrition for infants is breast milk, and it contains living cells, hormones, active enzymes, the antibodies to fight different conditions, low mineral content, which is great for the immature kidneys, long chain fatty acids. There's a high cholesterol amount in breast milk. So by 2 months, we're going to supplement with vitamin D, and at 6 months, there will be the addition of iron-rich foods as well as iron supplements. Artificial infant milk, despite strict standards, infant formula cannot duplicate human breast milk. However, it is way advanced from where we were years ago. Non-fat cow's milk is the basis for most infant formulas, and it will provide 20 kilocalories per ounce. Most of the new formulas include that DHA for brain and retinal development. The American Academy of Pediatrics provides guidelines for these that they must contain certain amounts of electrolytes, minerals, and vitamins. And then as far as fluoride, the ADA recommends the use of fluoride-free water to reconstitute these formulas until the age of 6 months. There's alternative artificial baby milk. Now these would be for babies that are lactose intolerant, colicky, different things like that. So soy-based formulas are available. They're often used for the relief of that spitting, vomiting, and fussiness, which we call colic. Studies do not indicate a huge benefit, but there have been many people that's the only thing their baby can keep down. Formulas for infants with special requirements, such as preterm infants and metabolic problems, such as the PKU babies that can't have certain things because they can't break down that amino acid. Formulas should be discontinued by the age of 1, and whole milk should be provided until the age of 2 due to that brain and spinal cord development and the need for the higher fat content. As far as feeding practices, infants typically eat 6 times a day in 4-hour intervals, and the feeding actually helps develop that oral and neuromuscular coordination. So sucking encourages development of the maxilla as well as the jaw and chin. Breastfed infants are less likely to develop malocclusion, that high premaxilla, abnormal alveolar ridges, and palate posterior crossbite. Infants that are breastfed for a year require 40% less orthodontia than bottle-fed babies, which is kind of interesting. And sucking from a bottle or pacifier, thumb, or fingers can result in a narrower upper and lower dental arches. That's probably why my palate is so stinking high, because I sucked my finger for many, many years. Suckling is replaced with sucking by the age of 4 months. So 4 to 6 months, sucking enables an infant to eat from a spoon semi-solid foods. So they have to get that coordination down before they can figure out how to take solid food and push it back and swallow it. If they don't develop that sucking ability, it's going to be really hard for them to eat. At 6 to 8 months, they develop the ability to receive food and chew. And once an infant is able to chew, a variety of textures are needed to prepare the infant to accept different foods later. So unless we provide them with those textures, that oral musculature can be delayed or slow, and it could also affect their speech. The introduction of semi-solid foods. At 4 to 6 months is when we'll start the introduction of cereals, typically made of rice, oats, or barley. They should be presented with a spoon, and formula intake should still remain around 32 ounces daily. Important to note that fruit juice provides no nutritional benefit for infants younger than 6 months old, so at this point we're not going to encourage that. And as we know, fruit juices have a lot of natural sugar, so that could also lead to issues for erupting teeth. Some of the disadvantages, a lot of people will try to give their baby semi-solid food to help them. They think it's going to help them sleep or keep them content longer. But some of the disadvantages to that are there's a high probability of overfeeding your baby. It's an unnecessary cost until 4 to 6 months. It can affect the immature digestive system. It can increase the risk of food allergies. It can reduce their intake of milk because they're filled up on other things, and which can then decrease their iron absorption. So the introduction of semi-solid foods at 6 months, 4 to 6 ounces of fruit juice could be given, but we want to dilute that with 50% water in a cup. It can be introduced in a cup. Due to possible allergies, food should be introduced one at a time. And if you think about our order of introduction, we want to introduce the least favored food first. If we introduce fruits first, like blueberry buckle or banana or some of those yummy, yummy baby foods, they're never going to take squash. So we start with vegetables and we try to encourage those, and we do them one at a time. That way we don't miss a food allergy. And then we go from vegetables to meats. Again, we're going to do one at a time to make sure the baby does well with each of those. And then fruits is the last thing that we're going to introduce because they are the preferred food. Once they get to the point where they can handle chewing, there's junior foods like little meat sticks and things that they can grab and put in their mouth to initiate chewing. And again, fluoride supplements would be recommended for children in areas that do not have fluoridated water after 6 months of age. Supplements. Breastfed infants and all non-breastfed infants consuming less than 1,000 milliliters of formula per day will need 400 international units of vitamin D supplementation. However, most American and Canadian infants do not consume adequate amounts of D, so most babies are going to have that supplementation. A healthy full-term infant requires minimal amounts of iron during the first 6 months and more significant amounts after 6 months, so you may be supplementing with iron as well. Nutritional deficiencies that occur during tooth development can affect the tooth size, the formation, how it erupts, and the susceptibility to caries. Mild to moderate malnutrition during that first year of life has been associated with an increase in caries in primary and permanent teeth. As far as infant oral care, even if an infant does not have teeth erupted yet, it is recommended that the gingiva is cleaned daily with a washcloth or a piece of gauze. They do make soft infant toothbrushes, and you can use that with water or an infant tooth cleaner to remove plaque biofilm. And during eruption, parents should brush teeth using fluoride-free toothpaste. The AAPD recommends the first dental visit by the age of 1. And when a child is able to expectorate or spit things out, usually around 2 to 3 years of age, a pea-sized amount of fluoride toothpaste can be used. So it's the American Academy of Pediatric Dentists that recommend that first dental visit by age 1. Typically, what these visits consist of is, depending on the child, is just kind of a look-see to make sure that everything is coming in and erupting as it should. We're not seeing any signs of baby bottle decay or gingival problems. Many times by age 1, children are too fearful to let you in their mouth to polish or things like that. Usually it's just a mere looking around on mom's lap. So that's kind of what to expect for that visit. Nighttime breastfeeding should be discontinued once teeth erupt due to the potential for decay. Infants and toddlers should not be given bottles at bedtime, preferably none at bedtime, but if they do need anything at that time, it should only be water. It shouldn't be juice or milk or anything that could lead to decay. And toddlers should be weaned from the bottle by 14 months of age and be drinking from a cup as soon as they can sit up and hold it. A sippy cup between meals with juice, soda, or other sweetened liquid places the child at risk for caries. So you want to make sure that the tippy cup has just got water or things like that in it that won't cause decay. Contributing factors for decay in young children are low education level of the parents, people that are living at poverty level, a child that wasn't breastfed. If they skip breakfast, many times they're going to fill their energy need with sugary drinks. Low fruit and vegetable intake and no dental visits for more than a year can all lead to decay in children. Early childhood caries. The definition of early childhood caries is the presence of one or more decayed, missing due to caries, or filled tooth surfaces in a primary tooth of a child younger than age 6. Severe early childhood caries is rampant decay that is often associated with inappropriate feeding practices, such as giving a child a soda pop or letting them sip on juice in bed or milk in bed. Children with severe early childhood caries will typically weigh less than their ideal weight for their height, and they are frequently below that 10th percentile on weight. This is what early childhood caries, that would actually be, could be severe. I'd have to see the back teeth to see how we are, but there's 1, 2, 3, 4 teeth I can see that are affected by decay right there. Some contributing factors, obviously Streptococcus mutans are the culprits for caries, and infection of the S mutans can come from the caregiver, from kissing or sharing utensils or other objects contaminated with saliva. A lot of times you'll see the binky fall on the floor, mom will pick it up, clean it off in her mouth and give it to the baby. So now you're transferring any bacteria or bugs from your mouth to that baby's mouth, and so that can lead to decay as well, or giving them the potential. Frequent or prolonged exposure to fermentable carbohydrates will inoculate those S mutans. They're going to feed on those carbohydrates. That is why those bedtime bottles or frequent daytime bottles, habitual use of no spilling training cups filled with juices, sodas, things like that can increase that risk. Prevention starts before birth with guidance for the parent so that parents know what can lead to that, what can cause that, and what to avoid. Begin this dietary advice as soon as your dental team is made aware of the pregnancy. Cleft lip and cleft palate, we discussed this in histology and embryology. That is malformation of the upper lip or palate. This will occur in approximately 1 out of 1,000 infants, and it can be cleft lip with or without cleft palate. Drugs, heredity, nutrient deficiencies such as folic acid can all lead to this malformation. Infants that are born with a cleft palate are at high risk of developmental delays, including motor skills. Very difficult to feed them. We talked a little bit about that. We have to feed them in an upright position so that the food does not go up into that open area in the palate. Some of the increased rates of dental abnormalities that we see with cleft lip and cleft palate are supernumerary teeth, missing teeth, and malformed teeth. So cleft palate, like we were talking about, prevents that negative pressure needed for sucking. So extra feeding time is needed for adequate nutrition. There are feeding devices that are made specifically for this that can be used. And other feeding issues would be that nasal regurgitation, excessive air with frequent burping. So spoon feeding is desirable as soon as the child is able. So some of the guidelines from the Healthy People 2020 are recommending this 5-step approach to choosing foods for meals. Select a mixture of foods from the 5 food groups. Offer a variety of food experiences. Highly processed foods should be avoided. Small amounts of sugar, salt, fat, and oils should be followed. And offer appropriate portions. Most children's diets need improvement, as we know. Between the ages of 2 to 5, children should adopt a diet consistent with the guidelines. They should have adequate energy, and only 25 to 35% of those calories should be from fat to have a positive effect on their life later. Less than 10% of their total calories should come from added sugars. And we want to watch the quantity that kids put on their plate. If we're serving them little bits, like a tablespoon, will go a long way. We don't need to put on their plate what we would put on our plate. So many times once a child gets old enough, if you let them serve themselves, it's interesting because it's like they have an automatic monitor that knows what they need and what they don't need. And when they're done eating, they'll push their food aside. If they're not hungry, they don't eat. They're very different than adults that way. Physical activity is important for their bone mineralization as well. So it's important to get them outside and get them physical. Toddlers and preschool children should have at least 15 minutes per hour for physical activity. 1 hour of physical activity daily for children 6 to 17 years old is recommended. Fiber is an important thing for children as well. So if you just take the age of the child plus 5 grams, that kind of gives you, so if a child is 5, they should have 10 grams of fiber a day. And then of course milk and dairy products are essential. The Choose My Plate website, again, is a wonderful resource. It will provide parents guidelines, tips, and encouragement for different aged children. It can give you age-appropriate activities for preschoolers and school-age children as well. And another thing that they have on there are different ways to get your children involved in food preparation and cooking at an early age. So toddler and preschool children. Toddlers and preschoolers typically gain 2 to 3 inches per year in height and 5 pounds per year in weight. So half of our adult height is achieved by 2.5 to 3 years of age, which is kind of interesting. Nutrient requirements that are most often deficient in preschoolers are iron, zinc, calcium, and vitamin D. To figure their caloric needs, we're going to take 1,000 calories plus 100 calories per year of life. So if they're 3, it'd be 1,300 calories a day. Lifelong habits and food attitudes are formed during these preschool years. And many times our attitudes as parents and our preferences for food and habits can influence the child. So that's something we need to think about when we're planning our menus. And we want to think about a child's food preferences, but we want to maintain control over that. You don't want to have a situation where every single night you're fixing a specific meal for that child. That just creates problems later in life. We set the example as parents. So for toddlers 1 to 3, finger foods should be provided. They should be able to manipulate a cup by around 18 months of age. We want to provide regular meals and snacks, but we want those to be healthy choices, fruits, cheeses. You want to be careful with things like carrots and grapes, anything that's a choking hazard. Hot dogs, you just want to make sure they're cut up into small sizes so that they can't choke on them. Serving size is going to be dependent on appetite. And you're going to see food jags with kiddos. They sometimes they'll sit down and they'll just eat like crazy, and then other days they won't eat at all. And they could be going through a growth spurt. There's lots of different reasons for that. So you want to try to let them kind of be the deciding factor within reason on how much they're eating. Again, prevent choking by closely supervising foods such as nuts and seeds, round or firm foods, dry or hard foods, potato chips, popcorn, things like that can choke people. Sticky or tough foods like peanut butter, tough meat, caramel candies, things like that. They shouldn't be eating caramel candies anyway, but if they are, let's make sure we're watching them so they don't choke. So preschool children ages 4 to 6 now are going to be more independent, and they're going to want to feed themselves. So we're going to cut fruits and vegetables into small pieces to increase their acceptance. They often prefer their foods separate rather than mixed. We want to model eating behaviors that are appropriate. Snacks are important in order for them to reach adequate nutrient intake. Easy to chew foods are usually better accepted. And remember, at this age, they may need 8 to 15 exposures to a food before they accept it. My son, one of my favorite vegetables is green beans. And from the time he was a baby, I was so excited to give him green beans. And all he ever did was spit them out all over me. So I tried more than 15 exposures to green beans, and still to this day, unless it is my green bean casserole, which is so amped up with cream cheese, butter, and everything else, the crunchy onions on top, that's the only kind of green bean that he will eat to this day. Attention deficit and hyperactivity disorder. We want to promote a nutritionally well-balanced, high-protein diet for these types of conditions. We want to limit sugars, add more of the complex carbs, and restrict synthetic food color additives. They've shown that there are many foods that can affect or exacerbate the symptoms of these disorders. And if any of you have been around an attention deficit or hyperactive person, or have had this yourself, or seen it in friends, it's a challenging condition to live with and work with and deal with. So researching your foods and the things that affect these disorders is really, really important. Children with special needs possibly could have mastication or swallowing problems. We see this with cerebral palsy and Down syndrome. In these cerebral palsy and Down syndrome, bruxism is very common. They have intellectual disabilities and abnormal sensory input and muscle tone. They can show difficulties with sucking, swallowing, spoon feeding, chewing, and independent feeding. Tongue thrust is a huge issue with many of these conditions, which can jeopardize their nutritional status because they're going to, with their tongue, push everything forward. And you'll find that if you have any patients that are Down syndrome, everything is pushed forward. It's very, very difficult to access the back teeth when you're trying to clean their teeth because their tongue wants you forward. So these are all things to keep into consideration when you're working with these children that have special needs. School-age children, now we're talking ages 7 to 12, only 22% of all children consume those 3 servings of vegetables daily. This intake may suffer because children don't take the time for meals. At this age, kids are active. They'd rather be out playing than eating. So sometimes it's tough to get those 3 servings of vegetables in. Bakery products, soft drinks, candy, and chips are favorites. So we prefer them to have nutritious snacks over those kinds of things if possible. Planning meals around food groups is important so that all of the necessary nutrients do get included in their day. More than 55% of children ages 6 to 15 have dental caries. So 21.5% of children ages 6 to 9 have untreated caries. 11.4% of children 13 to 15 have untreated caries. And then some racial and ethnic and lower socioeconomic groups have more. I think that could be just access to care or the ability to pay for care. Systemic fluoride is effective before eruption, so fluoridated water, anything that we ingest, fluoride supplements are effective before eruption and during the mineralization of those erupting teeth. After eruption, topical fluoride varnish like we use on our patients is very helpful for the reduction of caries. Then the other thing to think about is the application of sealants. Sealants is going to protect those highly vulnerable occlusal surfaces and deep pits and grooves in the teeth to reduce the caries risk even more. In adolescence, 17% of teens are at a nutritional risk due to biological changes in their body, social changes, psychological changes, cognitive changes, growth of long bones, secondary sexual maturation, fat and muscle deposition. Calcium, vitamin D, and iron are especially important at this age. 9% of girls and 31% of boys that are ages 14 to 18 get the recommended daily calcium that they should take in. Again, that's due to a lot of snack foods and sports drinks and pop. So building good bone mass during adolescence is the best way to prevent osteoporosis later in life. Our peak bone density for girls, like we talked about a little bit ago, is age 18, and for boys is 25. So it is very important to get enough calcium and vitamin D during this adolescent period. Some of the influential factors on adolescent eating behaviors are family, peer pressure, the media. Every time you turn on the TV or even on your phone, there's recipes or ads for fast food or whatever, so it's constantly in your face. And then economic and socio-cultural factors. Some internal factors that can affect their eating habits are their physiological needs, their body image and self-concept, their food preferences, and personal values and beliefs towards health and nutrition. Their main food choices are like I just stated, carbonated beverages, sports and energy drinks, orange juice, apple juice, flavored milks, hamburgers, chicken, spaghetti, pizza, fries, ice cream, candy, snack cakes. All those things are the things that adolescents want. That's what they see. That's what their friends are eating. That's what TV shows them. So that's what they typically munch on. 25% of the kilocalories that they consume come from high calorie, low nutrient foods. So they're going to see excessive sodium intake, sugar intake, and fat intake. They're probably not getting enough fiber. They're probably snacking a lot and not having meals like breakfast. They'll snack rather than eat it. They eat on the run, and they rely heavily on convenience and fast foods. I never go to Quick Trip to get my gas when I don't see a huge group of teenagers in there, stocking up on their favorite snack foods. We would like to, with adolescents, if we're trying to give nutritional advice, you want to avoid that lecture approach. We want to try to promote change, which is more important We want to provide them the information. We want to kind of negotiate with them and do some reflective listening. We want to enhance their critical thinking skills and involve them in their choices. Appeal to their physical image or muscular development. So kind of asking them questions like, well, what kinds of foods do you like? And then go from there. Like, as far as making a more nutritious choice, what things could you see yourself looking forward to or getting excited about, rather than your Gatorade? Do you like water with those little pouches of sugar-free drink mixes that you can add? Or, just get creative and try to engage them and enlist them to come up with more nutritional choices.